The first thing anyone noticed was the light. A strip of neon on the ER ceiling buzzed awake, flickering from harsh white to dull blue and back again. It had been doing that for weeks. On nights at Mercy Cross Medical Center, things were allowed to be broken as long as they did not bleed. Claire Monroe watched the flicker from the nurse's station hands around a paper cup of coffee that had stopped being warm a long time ago. Above her, a wall-mounted television should have been playing the late news. Tonight it showed only static gray snow racing across the screen, soundless behind its glass. A resident jogged past, tugging at his glove. "Channel 3 is dead again," he said. He said, nodding at the TV. Claire stood, reached up, and pressed the power button. The picture vanished. The room seemed to gain an inch of space when the static disappeared. "Let it rest," she said. The resident snorted and kept going, sneakers squeaking on tile. Claire sat back down. Her ID badge swung on its blue lanyard when she moved. The photo on it was 2 years old and looked like someone else entirely, someone who slept more and worried less. She thumbed it flat against her scrub top and pulled a chart from the stack. Behind her, monitors glowed in the low-light green lines crawling across black screens. A ventilator sighed somewhere to her left. Farther down the hall, an elevator chimed doors opening and closing on lives she would not see tonight. The smell of disinfectant threaded through coffee and the faint metallic tang that never really left the ER. Night shift. People who did not work, it liked to imagine empty chairs and bored nurses. Claire knew better. After dark, the city sent in what it could not handle. In daylight, drunk drivers, bad arguments, hearts that gave out once the phones at the insurance office stopped ringing. The chart in her hand read, "Laceration minor. Kitchen knife dinner gone sideways." She slid it into the outgoing rack. Her hands moved in small, precise motions, the kind that did not waste effort. "Monroe." The charge nurse Robbins loomed beside the desk clipboard, tucked under one arm. "You finished in 4. Staples are in," Claire said. "He is already bragging to his girlfriend." "Fine. EMS just called. Motor vehicle collision 10 minutes out if the freeway behaves. You are on trauma intake." "Okay." Robbins walked off toward the automatic doors, talking into his radio. Claire glanced at the wall clock. 8:12 p.m. Red digits glowed against beige paint. She rolled one shoulder, then the other. Fabric slid over the thin scar near her left elbow. It was a pale line hardly wider than a pencil mark. Most people never noticed it. On some nights, she barely did either. On others, it itched as if memory sat just beneath the surface, waiting for an excuse. Her phone buzzed once in her pocket. She checked it out of habit. Unknown number, one short line. "You still on nights?" She locked the screen without replying and left the phone on the desk. The emergency room did not pause for questions from numbers she did not recognize. Across from the station, the waiting room TV flickered through recorded laughter and canned applause. A sitcom audience cheered for a joke no one here could hear. The glass in the door reflected the room in front of her overlays of bright chairs and shadowed faces. Claire pushed away from the desk and cut across to Trauma 1. The room waited like a held breath. Gauze filled its bins. Suction lines coiled neatly on their hooks. Chest tubes sat in a clear plastic tray. The intubation kit lay sealed and labeled on the counter. Everything where it should be. The fluorescent bar above the bed flickered once, twice, then steadied. "Work with me tonight," she said quietly to the light. A junior nurse Bree leaned in the doorway, ponytail skewed, pulling on gloves one size too big. "You talking to fixtures again, Claire?" "They listen," Claire said. "That is more than I can say for half the residents." Bree smiled. "Robbins said we have a car wreck coming in. You want me here or in 2? If EMS says blunt trauma, grab extra IV lines," Claire said, checking the oxygen flow and monitor leads. "If they say blast, call Dr. Patel before they hit the ramp." "Blast," Bree made a face. "In Houston, that feels dramatic." Claire did not answer right away. For a moment, her gaze slipped past Bree to the hall beyond, then past that to something else entirely. Concrete instead of tile. Heat instead of air conditioning. A sky that flashed white for reasons that had nothing to do with thunderstorms. She blinked once. The fluorescent light hummed. Bree still stood in the doorway, waiting. "It never hurts to be ready," Claire said. "Got it. I will prep too," Bree replied, and her footsteps faded down the hall. The ER settled into its restless rhythm again. Machines beeped, vents sighed, voices murmured behind curtains. Someone laughed too loudly at something that was not funny. Life tried to keep going. Claire set her palm on the rail of the empty trauma bed. The metal was cool and solid under her hand. Her fingers curled around it like they had done the same thing many times before. The bed did not care who she had been before these blue scrubs. It only cared that someone stood ready when the doors opened. Far off at first, a siren started to rise. The sound threaded through the cinder block walls, growing clearer, climbing step by step as it turned off the main road toward Mercy Cross. It settled over the trauma bay, a long climbing wail that narrowed the quiet to a single sharp point. Claire drew in a slow breath, let it out, and stepped to the head of the bed in Trauma 1 as the ambulance pulled in outside. The siren cut off with a sudden drop in sound that made the quiet inside feel heavier. Through the glass doors at the end of the bay, red lights strobed across the wet pavement. The automatic doors struggled with their timing starting to close as the paramedics reached them, then jerking open again in a rush of humid night and exhaust. "Trauma coming in," Robbins called, already backing up to clear a path. "Monroe ready." Claire nodded once. Her hands found gloves without looking. The powdered latex snapped softly around her wrists. 2 paramedics drove the gurney into Trauma 1, the wheels rattling over the threshold. Water flung from their boots and from the edges of the stretcher cover. The man on the gurney was half under a thermal blanket, half out of his own shredded gear. He was taller than the bed could comfortably hold, broad through the shoulders with a chest harness cut open and peeled aside. Dark tactical fabric clung to one hip, soaked nearly black along his right flank. The smell arrived before the full picture did thick iron cutting through antiseptic. "Male 30s, the lead paramedic said, breath coming fast. "Name given as Logan Pierce. 1 primary blast to the right thorax, suspected secondary impact. Found on a rooftop, repeat rooftop in tactical gear. Hypotensive in the field. 2 large bore IVs in, vitals tanking on the ramp." Dr. Maya Patel stepped up on the other side of the bed, tying the strings of her gown with quick fingers. "Pressure. 80/50 and sliding," the paramedic said. "Heart rate 140, respirations fast, shallow, oxygen sat fluctuating on 15 liters. "Weapons?" Torres asked from the foot of the bed, scanning out of habit. "Gears with the squad," the second paramedic answered. "No visible sidearm on scene. Local PD cleared him for transport." Claire moved to the head of the bed, guiding the stretcher as it locked into the trauma frame. For a second, the man on the mattress was just another body in a storm of voices and instructions, another human being losing too much of himself on a floor that would have to be mopped later. Then his eyes snapped open. They did not roll or flutter. They opened with a clarity that did not belong to the numbers on the monitor. Dark irises focused on the ceiling, then dropped to scan the room in a sweep that felt almost mechanical in its efficiency. Left, right, the door, the glass, the people closest to his hands. "Logan," Maya said, leaning in, already reaching for the oxygen mask. "You are at Mercy Cross Medical Center. You are safe. We are taking care of you." He jerked one arm, ripping a strip of tape and nearly pulling out an IV. The paramedic grabbed for his wrist. Logan reacted faster, twisting away and sending the man's hand crashing into the metal rail. The ventilator line clattered against the bed. "Do not touch me," Logan said. His voice was coarse, but loud enough to cut through the crowded room. The heart monitor jumped protesting in high, fast beeps. One of the residents flinched and dropped a pen. It rolled under the bed and disappeared. "Sir, you are injured," Maya said, keeping her tone even but sharper now. "You need help. Let us help you." He looked at her for half a heartbeat, then beyond her to Torres, to Robbins, to the window where rain streaked the glass. "Where is my spotter?" he asked. The question hung there wrong in this place, gliding past everyone who did not understand it. The paramedic frowned. Collins glanced at Torres, not sure he had heard correctly. "Logan," Maya said, "right now we are your team. Where does it hurt the most?" His gaze moved past her again, tracking movement toward his legs, where another nurse tried to free a boot from his foot. "Stop!" he barked. "Hands off!" The nurse froze. Her fingers stayed wrapped around the heel of his boot, not daring to pull or let go. "Combative trauma patient," Collins muttered more to himself than anyone else. "Do we have Haldol up, maybe Ativan?" "No restraints yet," Maya said. "We are not there." "He is going to throw himself off the bed," Collins said. "He is not going anywhere with pressure like that," Maya replied, eyes flicking to the monitor. Claire watched Logan's chest. Each breath was a shallow pull that barely moved his ribs on the right side. The left rose a little more. The right flank beneath the torn vest gleamed wet in the harsh light. "SPO 268 and dropping," the nurse at the monitor called. Maya grabbed the oxygen mask again and tried to place it over Logan's face. He caught her wrist in his good hand, fingers tightening just enough to keep her still without breaking anything. "I said do not touch me," he said. His eyes were not wild. They were precise, as if he was assessing angles, options, the fastest way out. A faint squeak from the doorway marked Collins sliding a bit farther back, overwhelmed and trying not to show it. Torres stepped in a little weight-balanced, watching Logan with the recognition of someone who had seen this dance before, but wearing a different uniform in a different place. "This is not optional," Maya said. "You are bleeding out on my table. You want to stay conscious, you let me give you oxygen. Deal." Their eyes met. The air between them held for a moment, a stubborn line. Neither seemed willing to cross first. Claire could feel her own pulse in her throat. The room had tilted into a balance she knew all too well, even if no one else in it recognized the shape of it. That tight distance between someone trained to hold a perimeter and the people trying in their own way to breach it. Logan broke the stare first, not in surrender, but to scan the ceiling again. His fingers slackened just enough for Maya to slide the mask into place. He did not hold it. She did one palm steady on his cheek. Good, she said. Logan, I need to know if you can feel both your legs. He did not answer. His eyes kept moving, restless, hunting something. 2 large bore lines already in, the paramedic said. Fluids running. Another liter wide open, Maya ordered. Cross-match and type. Get blood ready. Claire moved around the head of the bed, adjusting the monitor leads where sweat and rain had loosened adhesive. Up close, she could see the fine tremor in the muscles of Logan's jaw, not from cold, not from shock, but from effort. He was not flailing. He was not fighting blindly. Every movement he made had a purpose, even if that purpose did not match theirs. Any obvious exit wound? Maya asked. Not seeing one, Bree answered from the far side, lifting the edge of the bloody vest. Entry is lateral, right flank, tight radius. Rib fractures, Collins asked. Likely more than a few, Maya said. Get imaging on standby. We can get him to CT in 10, Collins said, eager to be useful and to move the problem somewhere else. Once we stabilize his pressure, we roll him. Claire's hand paused on the monitor cable. 10 minutes? Flat on his back in a cold donut of a machine. She watched the rise and fall of his chest again. Left, right barely. The neon light overhead flickered twice. For a second in the stuttering brightness, the world bent. The ceiling flattened into a different one in her mind. Hotter, closer. The air tasted like dust and concrete. A different man groaned on a different piece of metal, begging her not to strap him down. The fluorescent bar steadied. The room snapped back into place. BP 72/40, the monitor nurse called. Heart rate climbing 150. Move, Maya said. We are losing him. I want sedation ready. If he fights us in CT, he is done. On it, Collins said, turning toward the medication cart. Logan heard that word. His fingers dug into the side rail. The pulse in his neck jumped under skin slick with sweat. No sedation, he said, voice rough behind the mask. You knock me out, I do not wake up in this building. He tried to sit. Pain folded him almost instantly. Blood bloomed fresh over the already soaked gauze at his side. He sucked in air that barely made it past his collarbone. Stay down, Maya ordered, one hand on his shoulder. You listen to me, Logan rasped. You tie me to a bed, you put me in a tube, I crawl out of here on my hands. You hear me. A metal tray rattled where Bree had set it too close to the edge. The sound of it shivering on the steel made the whole room flinch. Sir, that is enough, Robbins snapped from the doorway. Security is here if we need restraints. He jerked his chin at Torres. It was the kind of look that usually meant move and hold, the arms get control. Torres did not move. His eyes stayed on Logan's face, then on the bloody line along his flank. He has seen restraints before, Torres said quietly. He does not scare easy. The tension in the room thickened. Everyone could feel that they were on the edge of something, even if they could not name what. Claire reached for a fresh set of gauze, leaning in closer to the wound while the argument ran across the bed. Heat radiated from Logan's body. The blood at his side was already cooling in streaks on his skin, but new warmth kept pushing through, from deeper dragged upward by each ragged breath. The pattern of it was not random. It spread in a controlled fan across his ribs, not splashed, not messy. It looked almost drawn there, as if someone had traced a line and told the explosion where to go. She pressed the gauze into place, eyes narrowing for just a moment at the geometry written in red. For a moment, Claire forgot to breathe. The blood did not just pool. It spread in a controlled arc from the entry point along Logan's ribs, thinner at the edges, thicker at the center, like something had punched in and directed its own exit. Not random, not messy. Monroe, Maya said, snapping the moment. Hold that pressure. I need a better look once we get him to CT. Claire pressed the gauze down more firmly. Warmth seeped through the layers in a steady surge. What kind of blast was it? She asked, eyes still on the wound. The lead paramedic glanced up from his notes. Got partial from the squad before they peeled off, he said. They said rooftop. Controlled entry, then everything lit up. Might have been an IED, might have been a structural hit. No obvious crater when we got there. Just debris in the sky. No fire pattern on his gear, Claire said quietly. Too clean. Maya did not answer that. Her attention stayed on the numbers glowing over the bed. BP 68/38, the monitor nurse called. Oxygen sat back down to 65. We are out of time, Maya said. Sedation now, Collins. He was already at the med cart, ripping open a small packet, drawing clear liquid into a syringe. Got it, he said. This should calm him down enough to move. Logan heard that. Even under the mask, his mouth tightened. He shifted again, trying to push himself up onto an elbow. Pain caught him in a white flare. A rough sound clawed out of his throat, half curse, half strangled breath. "Logan, stop," Maya said. "You're just tearing it wider." "You put that in me," he said, staring past the mask at the syringe. "You will not like what wakes up." Collins hesitated, hand hovering. "He is delirious," he muttered. Claire was not so sure. The words were too focused. Maya grimaced. "We are losing his pressure. We do not have the luxury of negotiating. Low dose, just enough to keep him still." She reached for the syringe. Collins surrendered at relief in the way his fingers let go. "Hold his arm," Maya said. Robbins moved in from the foot of the bed. The nurse at Logan's left side reached for his wrist. "On 3, Robbins said. 1, 2. Logan twisted hard, faster than his blood pressure suggested he should be able to. His left arm snapped up, knocking the nurse's hand away. The IV line yanked taut. The pole wobbled and clanged against the wall. "Back off," he rasped. "You stick me, I am gone." The words rang in Claire's head. Gone did not mean dead. Gone meant elsewhere. Gone meant out. "Security," Robbins barked. "Torres, I need you in here." Torres stepped closer, planted at the side of the bed. His voice was low. "Sir, no one here is your enemy," he said. "We are trying to keep you alive." Logan turned his head slightly to look at him. Whatever he saw in Torres gave him pause just for a second. Marine tattoos fading under his uniform sleeve. The way he carried his weight on the balls of his feet. "You ever wake up in a room with no insignia on the door?" Logan asked. "People telling you are safe when you do not know their chain of command?" Torres's jaw tightened. "Cannot say I have," he said. "Then do not lie to me about safe." Maya made a sharp sound, softening it at the last moment. "Enough. We are in a hospital, not a war zone. This is standard of care. Claire, keep pressure. Robbins, hold his shoulder. Collins, when I say go, you inject." Orders landed like instruments on a tray. Everyone moved a little, lined up with their assigned roles. Claire did not move. Her fingers stayed on the wound, feeling the pulse of blood against the gauze. Beneath her hand, his ribs stuttered under each breath. The right side of his chest barely lifted now. Sedate him, lay him flat, wheel him away. That was the way it worked here. That was what they did every night. Her mind offered another picture, uninvited. A cramped stairwell, dust in the air, a man fighting the hands that tried to strap him down, yelling that the second blast would ride the first. Someone above them screaming for everyone to move faster. She blinked and the ER came back into focus. "Claire," Maya snapped, "are you with us?" "Yes." "Then hold the line and let us do our job." The words were not unkind. They still landed with a weight that tried to push her back into her assigned place. Claire looked up from the blood to Logan's face. Sweat traced a line down from his hairline, catching in his eyebrow. His eyes were clear, not fogged. They pinned her, then moved. He scanned the room again, cataloging positions, exits, threats. He was not afraid of the injury. He knew what that felt like. He was afraid of losing whatever control he still had. Dr. Torres said, "If we go hands-on, he will fight us. Hard." "We do not have a choice," Maya said. "He is going to crash on the table." "You sedate him now," Logan said, teeth clenched. "You hand me over." "You think I do not know that game?" No one responded to that. They did not understand. They heard paranoia in his voice. Claire heard something else. She lifted her hand from the wound for a second, just enough to see how fast the blood welled up in the gap. Fast. Relentless. There was not much time to argue with anyone. For years, she had swallowed instincts like this, let protocol carry the weight. Be the quiet one. Be the one who taped lines and rolled carts and did not question the orders spoken in certain tones. She could feel the habit trying to pull her now. Step back. Say nothing. Let him become another chart and another signed death summary. Her feet did not move. "Wait," she said, one word softer than the alarms. Maya frowned. "Claire, we cannot delay this." "You cannot force sedation on someone that awake without telling him what you are doing," Claire said. The resident blinked. "That is what consent forms are for," Collins said. "He is hypotensive," Maya said. "He can barely hold a thought. We stabilize first, we explain later." "He is holding plenty of thoughts," Claire said. "You hear how he talks. He knows exactly what he is afraid of." Maya's gaze sharpened. "Monroe, step back. I will not have a nurse arguing treatment while the patient bleeds out." Claire should have done it then. She should have moved out of the way and let people with more letters after their names carry it. Instead, she found herself stepping closer, not farther. The air near Logan's face was humid with his breath under the mask. Up close, she could see the tiny burst veins around his eyes, the scars that had nothing to do with tonight. The faint white line along his jaw where shrapnel had kissed and missed anything vital. "Logan," she said, "listen." He tried to turn his head toward her, but the mask in Maya's hand kept it still. His eyes tracked instead. "You are in an ER, she said. "Not a black site? Not a tent?" We need to get your lungs to a scanner and your blood where it belongs. You do not talk like them, he said. His voice was softer, scraping around the edges of the plastic. Like who, she asked. The ones who say safe and mean quiet. The neon light above them flashed again, cutting a frame of harsh white around his face. For a beat, her heart stuttered with it. The television in the waiting room crackled sound, bleeding through the half-closed door. For a second, a burst of static hissed, then cut back to canned laughter. Static. The word pulsed inside her skull clear, as if someone had spoken it aloud. Another life rose with it layered over this one, a headset pressing against her ears. The world narrowed to voices over a radio, call signs instead of names. She had not thought in that language in a long time. She had avoided it on purpose. It still came back fully formed. Echo team. Her hand was still sticky with his blood. She flexed her fingers once, then leaned down close enough that her words would land in his ear and no one else's. Logan Pierce, she said quietly. Echo team static on deck. The reaction was immediate. Every muscle in his body went rigid. Not thrashing, not lashing out. Just a full stop, as if someone had cut power to his limbs. His eyes widened, then focused on her like nothing else in the room existed. Maya felt the change under her hand. What did you say? Logan whispered. The sound barely made it past the mask. Say it again. Claire did not. She watched his face instead. Recognition rolled through it in waves. Disbelief, calculation, something that looked dangerously close to hope. You cannot be here, he said. You died in Riyadh. The room around them did not gasp. It did not understand the words enough to react. Only Collins, still holding the forgotten syringe, seemed to sense that something had shifted sideways. Did he just recognize her? He murmured to no one in particular. No one answered. No one answered. The sounds that did exist in the room rushed in all at once. The hiss of oxygen through plastic, the restless beeping of the monitor, the rustle of gowns and gloves. Maya blinked once, slow recalibrating. Riyadh, she repeated. Logan, I need you to stay here with us, not wherever that is. Logan did not look at her. His eyes stayed on Claire, the way a man might keep his eyes on a landmark in a storm. Static, he said the word catching in his throat. You are not real. Feels real to me, Claire said. Her voice was quiet. It still threaded through the cluttered air cleanly enough for him to catch each syllable. Collins shifted his grip on the syringe, knuckles whitening. Doctor, he said under his breath, what is happening? We are still stabilizing a trauma patient, Maya said. That is what is happening. Keep your focus. She did not look at Claire when she said it. She looked at the blood pressure reading at the jagged line of Logan's pulse. BP 65 over 30, the monitor nurse said. Oxygen sat at 60, heart rate 152. Those numbers should have meant confusion in his eyes, a fogged mind. They did not. Claire watched him watch her. There was a lot jammed into that stare. Sand, heat, a night she had folded and filed in the deepest part of herself. She could feel the edge of it pressing. Logan, she said, your lungs are in trouble. We are trying to keep them working. Everything else can wait. He swallowed, neck muscles straining against the strap of the mask. They said you did not make it down the stairwell, he said. We waited at the truck. Claire felt the scar along her elbow, itch sharp and sudden. Stories get messy in a collapse, she said. You know that. You were ahead of me, he said. You were calling positions. Static on Overwatch. His gaze flicked to the ceiling again, tracing the fluorescent bar of the vents. I heard the second hit, he said softly. After you went out. He mirrored the sound without meaning to the low monotone of static that fills a headset when a channel drops. The memory of it slid across Claire's skin. In the doorway, Bree looked back and forth between them. What is static? She whispered to Collins. A nickname pal, Collins guessed, from some unit. Maybe he's confusing her with someone else. Maybe Claire thought, or maybe not at all. Maya stepped closer to the head of the bed, bringing the syringe with her. Recognition is good, she said to Logan. It means you're perfusing your brain. It means we have something to work with. Now let me give you this so we can move you. Logan's eyes left Claire just long enough to take in the syringe in Maya's hand. His fingers twitched around the rail. Does she know what that does to people like me? He asked. People like you, Maya said, are still people. You get scared, you fight, we manage that. I do not get scared, he said. I get ready. Ready for what? Collins muttered, stress peeling his words thinner. Logan did not answer that. His attention had already shifted back to Claire. You came back, he said. Why did you come back? I work here, Claire said. That is the only reason that matters tonight. It was not an answer. He knew it. She knew it. The neon above them flickered again, a quick stutter like a shutter click. His eyes jerked up to it, then down to the edges of the room, counting. One door, one glass panel, too many unknown faces. He drew a breath that shuddered against the damaged side of his chest. This is wrong, he said. Maya exhaled through her nose. On that, she said, we agree. Dr. Collins now. She angled the syringe toward the IV port. Collins steadied it, ready to push. Claire spoke before the medication hit the line. "Logan," she said, "look at me." His eyes snapped back to her immediately, like a reflex wired in long before this hospital. "You know my voice," she said. "You trust my voice. So hear me. If you fight every hand in this room, you bleed faster. If you let mine stay where it is, you get a chance to tell me what put you on that roof." Maya shot her a look. "Monroe," she said, "this is not an interrogation." "No," Claire said, eyes still on Logan. "It is triage." He stared at her breath, hissing under the mask. "You should not be the one asking me that," he said. "You already know what puts men on roofs like that." "I am not asking why you were there," she said. "I am asking what hit you." The room seemed to narrow around the bed. Even the beeping monitor flattened out in her hearing. He hesitated. The movement of his chest grew tighter, like he was holding more than air in there. "A charge," he said finally. "Not some trash heap bomb. Clean, focused." It rode the wall and came in under the lip. "Shape charge," Torres murmured the term, slipping out of a long-ago briefing. Logan's gaze flicked to him, then back. "They knew where the nest was," he said. "They knew our angle. They cut the corner off the building instead of going through the door." Claire felt the gauze warm again under her hand, his blood reminding her how little time they had for words. "How many on that roof?" she asked. "3 up, 1 on the stairs," he said, "plus the spotter on the next block, or there should have been." He blinked and some of the focus in his eyes slipped sideways. Not from the injury, from what he was remembering. "They pulled the window," he said. "The extraction window, shifted it by 11 minutes. We were told new time, new pattern. We adjusted. We were still in the nest when it lit." Maya listened, eyes moving between his face and the blood pressure reading. Collins hovered by the IV, the syringe still a threat held just off to one side. "Who gave you the update?" Claire asked. His jaw locked. "Home element," he said. "Came down the pipe, only 5 with that channel." "5," she repeated. He nodded once. Each movement cost him. "Squad lead, handler, tech, me, spotter," he said. "That is it. That is who knew where we would be and when." His gaze sharpened. "And somebody sold it." The word sold sat in the space between them, thick and ugly. Bree shifted her weight, uncomfortable, without knowing why. Robin scratched something on his clipboard without looking down his pen, leaving an aimless line. The monitor stuttered again. "BP 60/30, the nurse said. "Oxygen sat 58, heart rate 155. Fear flickered in Maya's eyes for the first time, buried quickly. "This conversation is over," she said. "We can get more history if and when he is stable. Right now we work." She held out her hand. Collins placed the syringe in it like passing a baton. "Enough, Monroe," Maya said. "Step back." Claire felt every gaze in the room tip toward her for a second. Some were impatient. Some were questioning. None of them had her history in mind when they looked. She eased more gauze against the wound, pausing just long enough to feel the texture of the torn skin, the line of bruising that radiated out beneath the surface. The pattern was wrong for falling debris. It was wrong for shrapnel that did not care where it landed. This blast had cared. It had been told where to spend itself. "Claire," Maya said firmer. Claire lifted her hand away from Logan's side and stepped back 1 pace. Not all the way out, not to the wall, just enough to clear his arm. "Your call, doctor," she said. She watched Logan's face as she said it. The look in his eyes shifted a mix of anger and something like disappointment. Not at her exactly, but at the way gravity worked in rooms like this. Maya took his arm, fingers finding the IV line. "Small dose," she said, just to take the edge off. The needle touched plastic. Logan sucked a breath through his teeth. "Static," he whispered. "If I go down, you pull me back." His eyes did not leave hers. A memory slid over the moment, uninvited and clear. A different man, a different stairwell calling her by that same name as dust fell around them. She tasted grit at the back of her throat, as if the air here had thickened. Her voice came out before she had fully decided what to say. "Stay with me," she said. "You hear me, Pierce. You do not check out." Maya injected the sedative. Logan's fingers flexed once on the rail, then again. His eyelids fluttered, fighting the pull. The monitor line hiccuped, then steadied a fraction as the medication softened the sharpest edges of his panic. His gaze blurred at the edges, but kept finding its way back to Claire. "They were waiting on the roof," he said the words, slurring just enough to show the drug hitting his system. "They were not aiming at the city. They were aiming at us." His eyes closed for a second, then opened again. "They missed the kill shot," he added, a raw edge of pride under the exhaustion. "They only took the corner." Claire looked at the wound one more time and saw in the bruise and the blood the ghost of a building's missing edge. Not random. Not at all. The sedative slid into the line in a clear stream. No one spoke while it traveled, as if every person in the room could see the exact distance between the syringe and the vein. Logan's jaw unclenched first. Then the rigid line of his shoulder softened a little under Maya's hand. The fight did not leave his eyes entirely, but it sank back a few steps, watching from behind the glass. BP 68/32, the monitor nurse said. Heart rate 148, oxygen sat 59. Still terrible, Collins muttered. Terrible is better than none, Maya said. We get him to CT, we see where the hell he is leaking and fix what we can. She nodded at Robbins. Call ahead, tell them they have priority. He turned toward the phone on the wall. Claire did not move with them. Her attention stayed on the wound. Under the lifted edge of the vest and the soaked gauze, the bruising had begun to declare itself. It spread out from the entry point in a half circle, darker, in the middle lighter, toward the edge. The pattern hugged the ribs instead of bouncing off them. There was no scatter up toward the shoulder, no spray downward across the hip. Roll him a little, she said quietly. Bree glanced at Maya, got a short nod, and helped Claire tilt Logan just enough to see the back. There was no exit wound, no jagged tear from shrapnel punching all the way through. Just more bruising here in a thinner arc fading under the shoulder blade. Claire let him settle back. The monitor protested the movement and then settled into its anxious rhythm again. Claire, Maya said, we need transport, not curiosity. This is not curiosity, Claire said. She peeled away the top layer of gauze, replacing it quickly with a fresh piece so that the blood did not have time to spill. Her fingertips read what her eyes already knew. Controlled entry, directed force. No random spray. Behind her, Collins fumbled with a portable monitor cable. If we do not move now, we lose the window, he said. Color seeped out of Logan's face, leaving a waxy pallor. The sedative tugged at him, dragging his eyelids low, but they kept fighting their way back open. His breathing stayed shallow, more on the left than the right. Claire leaned closer to his chest, listening without a stethoscope first. Habit? Training? The human ear caught things equipment sometimes turned into clean lines and neat numbers. The left side rose and fell with strained effort. The air sounded thin, but present. The right side barely moved at all. There was a faint crackle under the skin near the wound, like distant rice paper tearing. Each breath made it worse. She reached for the stethoscope, settled the diaphragm under his collarbone, on the left, then on the right. Left a faint rush. Right, almost nothing, just the soft whisper of air trying to go somewhere it could not reach, hemmed in by trapped pressure. Breath sounds decreased on the right, she said. Which is why we need imaging, Collins said, to see what we are dealing with. We are dealing with a blast lung and a collapsing space, Claire said. Maya turned. We can confirm that in CT, she said. If he survives the trip, Claire said. The room took a breath together. No one liked the word if. Maya straightened tired patience showing around her eyes. Monroe, we are not in a forward operating base, she said. We do not guess at internal damage when we have scanners down the hall. Claire met her look. We are not guessing, she said. His right lung is trapped, his pleural space is full. You flatten him for imaging without giving that air a way out, and it crushes what is left. I see no distended neck veins, Collins said, grasping for something to hold competence. Trachea looks midline from here. This is not classic textbook tension. The word classic landed wrong in Claire's ear. Tension does not read textbooks, she said. It reads opportunity. Torres gave a short huff, halfway to a laugh, strained at the edges. She is not wrong, he said. Maya ignored that. What I am hearing, cousin, she said, each word chosen, is that you are suggesting we perform an invasive procedure based on your impression. No imaging, no surgeon scrubbed in, no firm confirmation. Do I have that correct? Based on his breath sounds, Claire said, his pattern of bruising, the mechanism of injury he just described, and the fact that his numbers are dropping with every minute we spend arguing. Her voice stayed level. Her hands were less calm. They hovered near the tray where a chest decompression kit sat wrapped in clear plastic. Even covered, she could feel the familiar weight of it. Maya followed her gaze. Absolutely not, she said. You do not have privileges for that. You are a nurse. The words should have slid off. She had worn that label long enough to know how to live under it. Tonight it landed like a miscalculated step. She heard another voice, not Maya's, in some other time. You are static, not a scalpel. She had argued then, too. Dr. Torres said, with respect, if she is right, CT could finish what the blast started. If Maya said, that is the word, you just said it yourself. The overhead light flickered. The shadows along the floor trembled with it. On the monitor, Logan's blood pressure dropped by another few points. BP 60/28, the nurse called. Heart rate 158, oxygen sat 55, he is circling the drain. He was still fighting the sedative, pulling his eyelids open every time they drifted too low. His hand, the one nearest Claire, flexed in a slow rhythm on the sheet as if he was counting something only he could feel. Claire looked at that hand, then at the tray again. Her thumb pressed against the edge of the plastic, just enough to make it crinkle. Maya exhaled. We do not have a thoracic surgeon in-house, she said. We have a general on call. He is 10 minutes out. You want to go poking near his lung without backup, that is malpractice. You search deep with imaging before releasing this pressure, Claire said. You lose the organ you are trying to save. That is practical, not malpractice. How do you know that? Collins asked. It was not a challenge, just confusion. Claire let herself remember fully for a heartbeat, sand under her boots. A man younger than Logan, with half his training chest filling with air on the wrong side. No scanner, just a kit and a timer, and her own fingers shaking from too much adrenaline. He had walked again. Later. Months later. She had seen him in a briefing room. The scar on his chest had aligned almost perfectly with the seam of his shirt. She had not been static in that moment. She had just been hands. You learn blast patterns close up, she said. Not from labs, not from charts, from bodies. Her eyes did not leave the tray. Claire, Maya said. Her tone had shifted. Less edge, more warning. Look at me, Claire did. Tell me you can land it clean, Maya said. Tell me you know exactly where that needle goes. The question was not an insult. It was as close to a bridge as Maya seemed able to build right now. Claire stepped to the side of the bed, fingers hovering over Logan's chest without touching. She traced the air in a line down from his clavicle to the second intercostal space mid-clavicular, then across to the safer lower entry anterior axillary line, where the trauma kit recommended for a tube in a chest like his. She could see the anatomy in her head as clearly as the instruments on the tray. Fourth or fifth space, she said. Anterior axillary, above the rib to avoid the neurovascular bundle. He has no obvious deformity there. The bruising supports a localized blast, not a full structural collapse. Bree watched her hand move. How do you even know those words? She whispered. Claire did not answer. Maya stood very still. Around them, the chaos waited, held on a tight string. Finally, Maya nodded once. You do not place a full tube, she said. You do a needle decompression. Under my supervision, we reassess, and then we decide about the tube. She turned to the rest of the room. This is not standard, she said. Everyone here understands that. No one argued. Collins swallowed. You want me to document this as your call? He asked. No, Maya said. You document that I authorized it. Monroe executes with my oversight. The pronoun landed with a faint thud on Claire's shoulders. She wanted it there. Torres stepped back half a pace to give her room. Then let her do it, he said. The decision did not change the numbers on the monitor. It did not refill Logan's veins. It did not erase the bruise blooming beneath his skin. It simply gave the crisis a direction. Claire ripped open the kit. The smell of sterile plastic and antiseptic rose with it. Her hands found the familiar weight of the needle and catheter, the way a musician might find a well-used instrument. She cleaned the skin in wide circles, pushing the blood aside, turning red to a wet, diluted pink. The bruising under his ribs looked angrier now, edges darker, center a sickly purple. Logan, she said, you still with me? His eyes fluttered open again. The sedative had blurred them further, but they still found her face. You going to jam something in my chest now? He asked. The words slurred, but the meaning was clear. Trying to give your lungs some room to move, she said. He made a low sound, almost a laugh. Feels familiar, he said. Do it on your count static. Her hand tightened on the needle for a fraction of a second. Not that name here, she said quietly. In my head, it is the only one you have, he replied. She let the comment sit. There was no time to unpack it. On my count, she said. Breathe with what you have. She placed her non-dominant hand along his side fingers, splayed, using bone landmarks to confirm placement. The needle hovered above the skin, waiting. 1, she said. The room went quiet. Even the monitor seemed to soften its protests. 2, she said. The fluorescent light hummed overhead, steady for once. 3, she pushed. Skin offered resistance, then muscle, then the subtle give when the needle pierced the pleural space. A hiss of trapped air rushed out around the catheter, warm and under pressure. It brushed her wrist like a small exhale of relief. Logan gasped. For a second, his fingers clamped on the rail. Then his shoulders dropped a fraction as the crushing force inside his chest eased. The monitor registered it before anyone else had time to say a word. BP 70 over 32, the nurse called. Oxygen sat up to 63, heart rate 140. It was not a miracle. It was a shift, enough to feel. Claire withdrew the needle, leaving the catheter in place, taping it securely, making sure the line stayed open to the collection system they rigged in a hurry. Maya watched her hands, every movement measured and clean. Good, Maya said. The word carried both surprise and something like respect. Now we see what we are actually working with. Logan's chest rose a little more on the right. Air moved where it had not before. His next breath came easier, if still ragged. He closed his eyes, not from surrender this time, but to ride the sensation of oxygen making it past the obstruction. Better, he whispered. Claire checked the dressing one more time. The bruising had not changed, of course. The mark of the blast was still written there, but his skin looked a shade less gray. His lips had a hint more color. Not safe, she said under her breath, mostly to herself. Just breathing. The neon light above them held steady, as if for this moment it had decided to do its job. For a few heartbeats, the room seemed to settle around the hiss of air leaving Logan's chest. His breathing lengthened by a fraction. The right side of his ribcage rose enough to be seen, not just guessed. The flash of pain that crossed his face was sharp, then dulled into something he could ride. BP 72/34, the monitor nurse said. Oxygen sat 65, heart rate 138. The numbers were still bad, but not freefall. Collins exhaled a breath he had been holding. That buys us some room, Maya said. We prep for CT now. Portable monitor, fresh lines. I want him on the scanner in 5. Bree moved for the portable monitor cart. Robin stepped out to make the call to radiology. The room started to rearrange itself around the new plan. Claire checked the catheter site again. No leak, no kinking, air still moving. She let her hand rest on the edge of the bed, fingers near Logan's wrist. His skin felt warmer than it had a minute before. Color had crept back from the bluish gray toward something closer to human. He opened his eyes and found her face without searching. That your first time? He asked, voice rough. No, she said. He studied her for a second. Thought not, he murmured. Maya leaned in with the penlight checking his pupils. Stay with me, Logan, she said. You are still not out of trouble. Understatement, he said. The fluorescent light above them buzzed louder for a moment. Its tone shifted into a high whine, threatening another flicker, then held. The room had the feel of something keeping itself together through will alone. From the corridor came the squeak of rubber soles and the distant chime of an elevator. Someone wheeled a cart past the glass panel, a blur of motion and stainless steel. Then the overhead speaker crackled. All conversation stopped. Every person in the trauma bay had heard that sound before. Routine announcements did not start with static. South Wing lockdown in effect, a calm female voice said. All staff remain in assigned units. Security to primary checkpoints. Military liaison inbound. The words dropped into the room like pieces of glass. Maya frowned. Repeat that, she said, looking toward the ceiling, as if expecting it to answer her directly. The announcement played again. Same measured tone, same phrase. Military liaison inbound. Collins looked at Robbins. Do we even have a protocol for that? He asked. Robbins's jaw worked. We have disaster drills, he said. Active shooter, mass casualty. I have never heard that one. Torres had turned his head toward the glass as soon as the speaker crackled. His hand drifted closer to his radio without touching it. In the waiting room beyond, a couple on plastic chairs glanced up from their phones. A child tugged on his mother's sleeve, more interested in the word military than the rest. Is this for him? Bree asked quietly, eyes flicking to Logan. We have no confirmation of that, Maya said automatically. Her attention stayed on Logan's vitals, but her posture had changed. Her shoulders were a little tighter, the line of her back straighter. She listened not just to the beeps now, but to the hallway. Claire followed Torres's gaze to the glass. 2 men in dark suits stood just outside the trauma bay. They were not part of hospital security. Their jackets fell right, their shoes were dry despite the rain. One held a slim phone at his side. Neither wore a badge with a hospital logo. They did not look at the monitors or at the gurney. Their eyes tracked the room cataloging faces. One of them paused when his gaze landed on Claire. It was only a fraction of a second, but it was enough. His focus sharpened the way Logan's had when he first came around. Claire felt the muscles between her shoulder blades tighten. Bree noticed the men and reached for the cord to pull the privacy blind down over the glass. Before she could, one of the suits lifted 2 fingers, small gesture palm out. Wait! She hesitated, hand still on the cord. Maya saw them then, the frozen posture of the younger nurse. Pull it, Maya said. Patient privacy still applies in this zoo. Bree tugged. The blind rattled down halfway slats, closing over the bottom portion of the window. The suits did not move away. Their torsos disappeared behind the beige slats, but their heads and shoulders were still visible in the upper opening like figures in a split frame. Who are they? Collins asked. Visitors do not wear tailored suits to the trauma bay, Torres said. You think they are with PD? Robbins asked. Torres kept his eyes on them. Too clean for local, he said. Too quiet. They did not look surprised at that announcement. They could be from any agency, Collins said. FBI, ATF, whoever deals with explosives. None of those sound like liaison, Torres replied. Claire worked tape over the catheter line. Her fingers moved with mechanical precision while her mind counted details. Lockdown, military liaison, suits at the glass. Her world had been built on these kinds of details once. Before she would have been on the other side of that glass, coming in with them, not waiting for them to walk through her door. Focus, she told herself under her breath. Say again, Bree asked, thinking the word was for her. Monitor the line, Claire said. If his breathing goes shallow again, call it out loud, not in your head. Right, Bree said, snapping her attention back to the equipment. Logan heard the announcement too. Even through the sedative haze, the change in the room seemed to reach him. He lifted his hand a couple of inches, tugging weakly at the mask. Claire caught his fingers before he could pull it off. "Leave it," she said. "It is doing the work you cannot?" He stared at her hand on his, then at the blind half pulled over the glass. "You hear that?" he asked, words slightly blurred. "Lockdown." "We heard," she said. "They do not do that for car wrecks," he said. "This was not a car wreck," she replied. His eyes moved to the ceiling speaker, then back to her. "Military liaison," he said. "You get those for certain kinds of targets?" "You are not a target," Collins said from the foot of the bed. His voice held more hope than certainty. Logan gave a faint huff, the closest he could get to a laugh. "Everybody is a target," he said. "Question is who you belong to when they pull the trigger." The comment sat in the air without an answer. Maya straightened. "All right," she said. "We keep functioning like medicine still means something. Collins, get that portable monitor attached. Bry, check his lines. Robbins, I want to know if CT is even receiving patients during this glorious lockdown." "On it," Robbins said, already heading for the hall phone again. He paused at the door when he saw the suits more clearly. "They blocking my hallway," he said under his breath. "Ask them to move," Maya said. He lifted his chin and walked out. The door swung closed behind him, muting his voice. The blinds hid most of the exchange. Through the top inches of uncovered glass, they could see his back and the still figures in front of him. Torres shifted closer to the door, not enough to eavesdrop, just enough to be there if needed. The waiting room television switched from canned laughter to a news segment without anyone pressing a button. For a moment, the picture stuttered pixels, smearing into gray static, then resolved into footage of a burning convoy in a desert. The sound turned down. Claire caught the image in the corner of her eye. Heat shimmered on the screen. The camera shook. A caption at the bottom scrolled words she could not fully see from here. She turned back to Logan. "Pain level?" she asked. "High," he said. "Manageable." His breathing did sound better. Still labored, but less trapped. The sedative had dulled his edges, not erased them. "Chest feels like someone parked a truck on it instead of a building," he said. "That is an improvement, she said. "Debatable," he murmured. The door opened again. Robbins came back in lines of frustration etched around his mouth. "CT is on hold," he said. "They will not clear anyone until they know what this lockdown actually means. Overhead says shelter in place, no transfers." Maya's shoulders sagged just enough for Claire to see it. "Perfect," Maya said. "So we have a critical chest trauma and no scanner. Security is stacking at the north and south entrances," Robbins added. "They keep saying liaison. No one is telling front desk anything." Torres's radio crackled at his hip. He unclipped it, listened, then clipped it back. "Hospital security is being told to hold perimeter and wait," he said. "Wait for what?" Bree asked. Torres looked at Logan, then at Claire, then away. "They did not say," he answered. The suits at the window had not moved. One glanced at his watch. The other spoke into a phone, lips barely moving, eyes still on the room. "They are not watching him," Claire said. Bree followed her line of sight. "They are obviously watching the patient," Bree said. "Why else be here?" "No," Claire said. "Look where their eyes stop." One suit's gaze slid past the bed, past the monitors, to a point slightly left of center, where she stood. The hairs on her arms rose. Logan saw them too. Even through the sedative haze, his field instincts were alive enough to map the attention in the room. "They are not here for a consult," he said. Maya pressed a hand to her forehead for a second, then dropped it. "Whatever games are playing outside that glass, my priority is still the man bleeding on my table," she said. "Until someone walks in here with a badge and paperwork, I do my job." "Assuming they let you," Collins said. Maya shot him a look. "We are not starting that kind of thinking," she said. Claire felt the old reflex in her hands, the need to check exits, to calculate distances, to frame the space, not as a room, but as a box with limited escape routes. She curled her fingers tighter around the bed rail instead. "You have done your job," she said to Maya. "You bought time. He can breathe. We can hold until CT opens again." "Hold on what?" Logan asked. "On you," Claire said. "Not letting your lung collapse on my watch." He looked at her. "Feels like you have been on my watch longer than that," he said. The line sat between them, heavy with things neither had said out loud. The blinds rattled. One of the suits had tapped the glass gently, the sound muted but still invasive. Maya snapped her head toward the window. "They can wait," she said. The suit made no further move, just held his place, an unmoving shape behind slats. The overhead speaker crackled again. "All clinical staff in South Wing," the calm voice said. "Remain in patient care areas. Do not approach exits. Military liaison arrival in 3 minutes." "3 minutes for what?" Bree whispered. "For a conversation," Torres said. "They are locking the building to keep something in, not out." No one argued with him. The monitor above Logan beeped a little slower now, adjusting to his improved airflow. The green line stepped across the screen. Numbers climbed by small increments. Claire watched them, then let her attention drift back to the blinds. The slats cut the view into narrow strips. Through one she saw a sliver of a shoulder, through another part of a jaw, through a third the edge of a phone pressed to an ear. It looked like a document redacted by someone who knew exactly which lines mattered most. Static from the waiting room television leaked through the door, again a soft hiss that rose and fell with the glow of the screen. Claire rubbed her thumb along the metal of the bed rail, grounding herself in its cool solidity. The last time she had heard the word liaison in a voice that calm, a helicopter had been waiting on a tarmac, blades turning slowly, carrying orders she had not been allowed to refuse. She breathed in then out, keeping the motion even. "Inhale," she said to Logan. "Exhale." He matched her tempo without comment, eyes still on the blind. The trauma bay felt for a moment like the inside of a held breath, full to the edges and waiting for whatever came through the door next. The 3 minutes ran out quietly. No siren, no trumpet. Just the soft click of the trauma bay door as it opened from the hallway side. Conversation flattened. Even the monitor sounded less loud. One of the suits stepped in first. He held the door for the man behind him. That second man was not taller or broader than the others, but something in the way he carried his shoulders made space for him without asking. His hair had gone mostly gray. At the temples, his tie was dark and correctly knotted. His shoes caught the fluorescent light in a dull shine. He did not hurry. He walked as if the room already belonged to him, and he was simply inspecting it. He let his gaze pass over the staff once. Robbins, Collins, Bree, Maya, Torres, each got a clean, quick read. Then his eyes landed on Claire. They stopped moving. "Dr. Patel," he said. His voice was calm, touched with a kind of easy courtesy. No accent that could be pinned to any coast. He said Maya's name as if someone had given it to him an hour ago on a sheet of paper. Maya instinctively stepped closer to the bed, placing herself between him and her patient by a fraction of an inch. "That is me," she said. "You are—" He shifted his attention to her without really looking away from Claire. "Dalton Reed," he said. "I am here under authorization attached to your current trauma. Pierce Logan, 34, brought in with blast injuries." "You will need to speak with administration," Maya said. "We are in the middle of critical care. You can wait outside." "I prefer to speak where the facts are still warm," Reed said. He looked at Logan now, not his wound, his face. "Petty Officer Pierce," Reed said. "You arrive in interesting ways." Logan blinked behind the mask. "I do not know you," he said. "You do not need to," Reed said. "Your file reads clearly enough." He took one more step in. The suits from the hallway positioned themselves just inside the door, now closing it with a soft thud. The blinds rattled against the vibration. Torres shifted without thinking, adjusting his stance so he was between the door and Bree. "Sir," Maya said, "I do not care whose name is on your clipboard. In this room, I am responsible for him. If you have questions, you can ask them later." Reed watched her with the faintest hint of appreciation. "And I respect that," he said. "I am not here to interfere with your medicine. I am here to understand the context that produced the need for it." "This is not a press briefing," Collins muttered. Reed glanced at him. It was not a threatening look. It still made Collins straighten his back and shut his mouth. Reed turned again to Logan. "You were engaged in rooftop operations at 2000 hours local," he said. "Your nest took a direct-shaped charge. Your team did not fare well." Logan's fingers tightened on the sheet. "You reading my vitals off a report or off my chest?" he asked. "A little of both," Reed said. His gaze slid to the right side of Logan's rib cage, taking in the dressing, the bruising, the taped catheter. "Who placed that line?" he asked. "She did," Maya said before anyone else could. "Under my authorization?" Reed followed the slight tilt of her head toward Claire. There it was again, that attentive stillness, the sense that he had walked into the room knowing what he wanted to find and was now confirming it. "Monroe Claire," he said. "Night shift nurse." He rolled the words like inventory. "That is what my badge says," Claire replied. "It says a great deal less than the other name in your file," Reed said. Her neck muscles tightened beneath her scrub collar. "What file?" Bree whispered. Reed did not look away from Claire. 9 years ago," he said, in a stairwell in Riyadh, a medic with the call sign Static walked out when most of her team did not. The fluorescent light hummed louder. Somewhere in the waiting room, the television cut to static for half a second, as if the word had triggered it. Maya looked between them. "Call sign," she repeated. "You are military." Reed smiled without much warmth. "Call signs do not always land neatly in one branch," he said. "Some programs borrow." His eyes did not leave Claire. "You left Echo without debrief," he said. "No exit interview. No reintegration protocol. You vanished so thoroughly they wrote your file down to a rumor." "I requested removal," Claire said. "You requested silence," Reed said. "You did not request clearance. You simply stopped answering." There it was, the thing she had kept closed for so long that she almost believed it had dissolved on its own. Sir, Maya said, forcing herself back into the line of conversation, none of this changes the fact that my patient is critical. If you have business with my staff, it can wait until he is stable. Reed looked at her with a measured nod. You are correct that the man bleeding on the table demands your attention, he said. He is not why the South Wing is locked down. You said this was about his trauma, Collins said. I said my authorization is attached to it, Reed replied. That is different. He moved closer to Claire. Not close enough to crowd, close enough that she could smell the faint, clean scent of his aftershave out of place in the harsh hospital air. You chose a quiet life, he said to her. Night shifts, scrubs, people who see you as the rookie, and not the reason their rates improved this year. Seems like that quiet did not last long, she said. You did an admirable job of keeping it, he said. We noticed and we let it stand. You let it stand, Claire repeated. That is what you call not hunting me. We honored your withdrawal, Reed said. Plenty of our people ask for that. Few of them earn it. The words brushed against a memory. A room with no windows, a stack of papers she had refused to sign, a hand on her shoulder telling her quietly to run before they changed their minds. Then why are you here? She asked in my ER during my shift. Reed gestured very slightly toward Logan. Because your signature reappeared, he said. On a rooftop blast pattern and in a name spoken by a man who refuses to die until someone he trusts tells him it is allowed. He nodded at the dressing on Logan's side. The charge that hit him carries a design we have seen before, he said. Same geometry, same economy of force, not widely used. Enemy tech, Torres asked. Reed gave him a small glance. It would be comforting to say that, he said. It would not be accurate. The room felt tighter now. Air moved less easily between the bodies. You are saying this was friendly fire, Collins said. I am saying friendly does not always apply to the people holding the triggers, Reed said. Logan shifted, dragging their attention back to him. You knew, he said. You knew they sold the window. Reed did not answer right away. His eyes on Logan were almost kind. We knew there was a breach somewhere in the chain, he said. We did not assign guilt without confirmation. So you staged a second hit, Logan said, to see who twitched. His eyelids drooped. He forced them open again. You rode that blast all the way up my ribcage, he said. You built it to hurt, not kill. Not kill you, Reed said. Correct. Bree's hand flew to her mouth. You did this to him on purpose, she said. You are saying this out loud. Reed regarded her as one might regard a student in a class he had not planned to teach. The charge was placed with precise intel, he said. We modeled the likely injuries. We predicted survivability. You predicted, Maya said. She sounded tired in a way that had nothing to do with her shift length. You played math with his body. We made decisions based on acceptable risk, Reed said. Acceptable to who? Claire asked. To the program, he said simply. The word program hung heavier than the rest. Logan coughed a thin, dry sound that still sent a spike across the monitor. You used my team as bait, he said, to pull a ghost out of hiding. Reed did not correct him. We needed to know if static still existed, he said. Silence is useful, but it is ambiguous. We needed clarity. He turned back to Claire. You could have let the call sign stay buried, he said. You could have stood at the back of the room, assisted, charted, never leaned down to his ear. You could have not lit up a rooftop, Claire said. Both statements are true, Reed said. Claire stepped around the bed until she stood directly across from him, the mattress between them. You hurt 4 men to check if one woman still answered a name, she said. His face did not shift much. His eyes stayed steady on hers. We calculated 3 fatalities, he said, and 1 survivable trauma based on Mr. Pierce's record. He is exceptionally difficult to kill when properly motivated. Logan let out a cracked laugh that hurt to hear. You hear that, he said. Properly motivated. Claire felt her nails dig into her palm. You did not give any of them a choice, she said. Reed did not apologize. He did not justify either. He simply continued as if listing facts. You, Claire, did have a choice, he said. You chose to step in. You chose to reach for a chest kit instead of letting the CT room do the rest. You built a bomb that wrote a message in a man's body and waited to see who could read it, she said. Reed inclined his head. And you read it, he said, which tells us what we needed to confirm. Maya cut in voice sharp. Confirm what? She asked exactly. Reed looked at her as if remembering she was there. He softened his tone a fraction. That Claire Monroe and the asset once known as Static are still functionally the same person, he said. That she did not lay down her skill set when she laid down her rifle. I never carried a rifle, Claire said. Reed lifted one shoulder. Fine, he said. Your medkit then, your headset, your presence on roofs the rest of the city never sees. Logan shifted his head on the pillow, eyes sliding back to Claire. You should have stayed gone, he said quietly. They do not let ghosts walk for long. Reed heard him. We let you walk, he said to Claire. For 9 years. We answered your silence with silence of our own. That was a courtesy, not an obligation. Courtesy, she repeated, tasting the word. Now you are taking it back. We are adjusting to new information, Reed said. You are not a memory, you are present. Active whether you admit it or not. Maya folded her arms. She works for this hospital, Maya said. For my department. She is not your operative. Reed regarded her with something almost like respect. In the eyes of this facility, that is true, he said. On our books, the situation is less simple. You cannot just walk in here and claim her, Bree said, shock finally burning through her fear. Reed looked at her. For a moment, his expression softened. We are not here to drag Nurse Monroe into a van, he said. Those days have mostly ended. Good to know you have standards now, Claire said. We have optics, he replied. The honesty in that was almost worse. He focused again on Claire, drawing her back into the center of his gaze. You are reinstated under advisory capacity, he said, effective as of the moment you used your call sign to calm a field asset. I did not reinstate anything, she said. I told a man what he needed to hear, so he would stop tearing out his lines. In doing so, you accepted that static is not as dead as the file suggested, Reed said. Claire felt a headache start behind her eyes, sharp and familiar. I'm not going back into Echo, she said. We are not asking you to, Reed said. Echo looks different now. So does the world it worked in. He stepped back half an inch, giving her a little more space, then took her in again, as if he were adjusting a lens. We are saying this, he continued, as long as you remain here quiet, unknown, we have no interest in disturbing your carefully built life. As long as Static does not begin speaking names she should not, as long as she does not start connecting dots in public, as long as this hospital stays just a hospital. And if I do not meet those conditions, she asked, then we stop letting you pretend you are only Claire Monroe, he said. His tone did not harden. That made it worse. Logan listened to that with a kind of resigned clarity. You see it now, he said to her. They burned my nest to smoke you out. She nodded once, a small, helpless motion. Looks that way, and I said. Reed cut in. We did not burn it, he said. We allowed a pattern to play out that gave us confirmation. And here I thought I had trust issues, Logan said. Maya stepped closer to the bed again. Whatever games your program is playing, she said to Reed, they can continue without my patient conscious for them. He needs blood. He needs imaging. He needs you not standing in my trauma bay making threats dressed up as contracts. Reed inclined his head. You are correct, he said. Mr. Pierce does require further care. The lockdown will lift shortly. CT will resume. Blood will arrive. On whose order? Robbins asked. On mine, Reed said. He turned to one of the suits at the door and gave a small nod. The man stepped out into the hall, phone already at his ear. Reed looked back at Claire. Your status has changed, he said. Nothing else has to, not if you do not want it to. You built a bomb and called it a question, she said. Forgive me if I do not believe you are finished asking. He smiled then, a brief, tired expression that did not touch his eyes. Belief is optional, he said. Compliance is not. The monitor hummed, the neon light buzzed, the faint hiss of the catheter at Logan's side went on doing its quiet work. Claire listened to all of it. Then she did the only thing she could do that felt real. She put her hand back on the rail next to Logan's arm. I am not your ghost, she said to Reed. I am a nurse with a patient who is still in danger. Reed watched her fingers curl around the metal. In this room, he said, those roles are not mutually exclusive. The words settled into the hum of machines and the smell of antiseptic tying strange parts of her life together, whether she wanted them to touch or not. For a long breath, no one spoke. The machines filled the space instead. The monitor ticked out Logan's heartbeats. The oxygen flowed. The catheter at his side sighed softly with each release of trapped air. Claire kept her hand on the rail, fingers curved, knuckles pale. Reed watched that hand like it was the most instructive thing in the room. You think you quit, he said. Her eyes lifted to his. I did, she said. You walked off a tarmac, he replied. You walked past a debriefing room. You did not shut off the part of you that calculates blast geometry and chest access under pressure. I do not owe that part to you anymore, she said. You never owed it to me, Reed said. You owed it to the work. That is what you tell everyone, she said. It is what they tell themselves, he said. Maya drew a breath that shook a little at the edges. If you are done assigning philosophy, she said, I would like to get my patient to imaging before his ribs decide they have had enough. Reed inclined his head. We are close to clearing your hallway, he said. Radiology will answer your call. The lockdown is a formality now. You keep saying that word, Collins said. Formality. It does not feel like one from here. Reed did not answer him. Logan shifted again, small motion, careful not to disrupt the dressing. You got what you came for, he said to Reed. You poked the ghost. You heard it talk. Why are you still standing in my air? Reed looked at him with a trace of something almost like respect. You absorbed damage tonight that would have folded most operators, he said. I am not blind to that. You are not the one who has to feel it, Logan said. True, Reed said. I am not. He let his gaze move between Logan and Claire as if looking for a line that connected them that he had not already measured. You both came out of places designed to keep people from leaving, he said. One on paper, one in practice. Yet here you are in the same fluorescent room. That is your doing, Logan said. It is the result of choices made by people along a chain, Reed said. Some of them mine. Claire shifted her weight, the rubber soles of her shoes whispering against the tile. You said advisory capacity, she said. What does that actually mean? It means we will not ask you to put on a helmet or step onto foreign concrete, Reed said. It means we will not hand you a rifle or a radio. You keep saying rifle, she said. I never carried one. You carried enough, he said. He folded his hands loosely in front of him, as if he were simply explaining a policy to a colleague. In practical terms, he went on, it means this. You remain where you are, you keep clocking in, you keep stacking charts and stitching drunks and decompressing lungs when cars meet poles. His eyes flicked to the dressing on Logan's side. And when something crosses your path that smells like Echo by any other name, he said, you notice it. You do not look away. You call a number that will be given to you. You say as little as possible and just enough. So you want me to be a censor, she said. A tripwire in scrubs. That is one way to phrase it, he said. It is the honest way, she replied. He let that pass. In return, he said, we do not reopen your file beyond the level required by tonight. We do not send men to your apartment. We do not ask you to get on a plane. We let Claire Monroe remain the name on your badge and not the heading on a classified memo. And if I decline, she said. The room seemed to lean toward his answer. Reed looked at the blinds as he spoke, not at her. It made his words feel more official, less personal. If you decline, he said, we begin the process of securing every person in this room with non-disclosure agreements, psychological evaluations, follow-up visits. We relocate this incident from the realm of routine trauma to a matter of national security. Bree swallowed. Her glove creaked. We would not be able to talk about any of it, she said. You would not even be allowed to describe your own shift accurately, Reed said. That is not medicine, Maya said. That is erasure. It is containment, Reed said. Sometimes they look similar. Logan watched the exchange with eyes that had seen too many rooms where the word containment was used like a bandage. They would yank me back too, he said. Get me on a plane before I could walk down a hallway. Reed looked at him. Your redeployment is not under review at this moment, he said. You have enough to manage with your recovery. That is not a denial, Logan said. Reed did not correct him. There is another category, Reed added, eyes on Claire again. If you choose something more active. There is no more active, she said. You already got too much. You could consult, he said. Off-site, distance. Let your experience bleed in without your presence on a scene. No, she said. The word was flat enough to make Bree flinch. Reed waited as if expecting more to come. When nothing did, he nodded slowly. Then we are back to the simpler version, he said. You do nothing different in any visible way. You live the life you have been living. You keep your head down. You treat injuries. You do not talk about Riyadh or Echo or a stairwell that went quiet before all the men in it stopped breathing. Her throat tightened at the last phrase. You expect me to stay quiet about the fact that someone sold that nest, she said. We expect you not to begin naming suspects in a crowded room, Reed said. We expect you not to speculate in public. We expect you not to dig where you are not ordered to dig. I do not take orders from you, she said. You never stopped, he said. You just stopped hearing them. The fluorescent light buzzed, then steadied. The television in the waiting room flicked to an advertisement with bright colors and tinny music that did not make it fully through the door. Torres shifted his stance again, his eyes moving between Reed and Claire. You say advisory, Torres said. Sounds a lot like leverage. Reed did not look at him when he answered. We all live under some kind of leverage, he said. A mortgage, a badge, a memory. I thought that was philosophy off the table, Maya said. Doctor, Reed said, you went into medicine to help people. Something pulled you here instead of a small clinic in a quieter town. Everyone in this room has a reason for standing where they are. That does not give you the right to weaponize it, she said. I am not weaponizing, he said. I am acknowledging. He turned back to Claire once more, as if the others had receded. You did good work tonight, he said. For him, he nodded at Logan. You also confirmed something we needed to know, he added. For them. He did not specify who them was. He did not need to. Logan watched Claire's face while Reed spoke, searching it for signs of fracture. You do not owe them anything, Logan said. You saved my lung. That debt is mine. It's not about debt, Claire said. Her voice sounded different in her own ears, lighter at the top, heavier at the bottom, as if it were carrying the weight of both the room and the stairwell behind it. Then what is it about? Logan asked. Containment, Reed said. Claire ignored him. It is about not dragging everyone else into a hole they never volunteered for, she said. She looked at Bree, at Collins, at the monitor nurse, whose name she suddenly could not remember, at Robbins with his sharp edges and tired eyes, at Maya standing like a thin wall between her staff and the suits. They did not sign up for Echo, she said. They signed up for 12-hour shifts and bad coffee and being underpaid to be screamed at by family members. They signed up to treat whoever comes through their doors, Reed said. Tonight that included one of ours and one of ours who thought she was no longer ours. You keep using that word, she said. Ours. I am not an object. You are a resource, he said. Valuable, scarce, proven. Logan made a low sound. Stop talking about her like she is a weapon system, he said. Reed's eyes moved to him. In the after-action reports, Reed said, every man who survived a rooftop with static on comms described her as the reason they did. Logan's mouth twisted. That does not make her your property, he said. Property is the wrong frame, Reed said. She is capacity. Claire felt the urge to laugh and found she could not. If I say no, she said, and you start your containment wave, it will land on them too. She nodded at the staff. They will get dragged into interviews and checklists and someone shadowing them on their shifts, she said. Their families will get nervous, their paychecks will get delayed, because some piece of paper is sitting on a desk with a different seal on it. Reed did not argue. If I say yes, she said, I give you permission to use my name whenever some pattern on a wall looks familiar. You already did, he said. You used your call sign. That was not for you, she said. That was for him. Logan's eyes softened around the edges. It worked, he said. You pulled me back. That is why we chose him, Reed said. The line was so casual that it took a second to land. Claire's stomach went cold. Say that again, she said. Reed seemed almost impatient for the first time. We modeled survivability, he said. Mr. Pierce carries a history of walking off hits that would have turned other assets into folded flags. We knew if we lit his nest in a specific way, he would make it as far as a hospital. So you did not just gamble with his life, Claire said. You gambled because you liked the odds. We do not send people to rooftops without accepting that roof lines break, Reed said. We saw an opportunity to answer 2 questions with 1 charge. Bree shook her head slowly. That is not how any of this is supposed to work, she said. It is how it has worked for longer than you have been in Scrubs, Reed replied. Maya's voice cut through. You will not say another word like that in front of my staff, she said. If you have to explain the ethics of your operations, you can do it to an empty hallway or in a hearing room, not in my bay. Reed regarded her for a beat. Then I will keep this part very simple, he said back to Claire. You stay, he said. You live the life you already chose. You answer our call when it intersects with what you have already seen. You protect these people from the weight of your previous choices by letting us use your insight when we need it. And if I falter, she said, then we adjust, he said. You mean you remind me who still holds the file, she said. He did not bother to deny it. Logan ground his teeth, then winced at the movement. I do not like that any of this is dropped on you, he said to Claire. It was never going to land on anyone else, she said. He frowned. You could have kept your mouth shut, he said. Let me break my way through the rails. Let them sedate me angry and confused. She thought about that for a second, really considered the picture. Logan, strapped sedated, rolled out, waking up later with strangers asking questions he did not know how to answer. No, she said. I could not. Why not? He asked. She looked down at his hand, at the faint scars there, at the white knuckles. Because I heard my own voice over a headset that night, she said. I heard it cut out. I remember how it felt to be on the other side of that silence. Static from the waiting room slid under the door, a soft hiss that seemed to underscore the word. Reed glanced at the television, then back. You are not the only ghost in the building, Pierce, he said. No, Logan said. Just the only one who did not know the haunt was still on duty. The monitor beeped steadily now, a hesitant rhythm finding its footing. The catheter at his side kept working. The blood pressure reading crept up by another point. Reed looked at the numbers. You have some time before you wheel him anywhere, he said. Use it well. We plan to, Maya said. Reed stepped back from the bed. For what it is worth, he said to Claire. I am glad you were on shift. It's not worth much, she said. He accepted that with a slight tilt of his head. Your reports, when written, he said, will go through a separate channel. You will be briefed on that before the end of your shift. He turned toward the door. The suit straightened as he approached, bodies orienting to his path without a word spoken. At the threshold, he paused, hand on the push bar. You are not the only one who wanted you left alone, he said without turning. But you are the only one who picked a place where saving lives looks enough like who you were that we can tolerate the resemblance. Then he pushed the door open and stepped out into the hallway, leaving the air in the trauma bay buzzing with the echo of things that did not fit into any standard hospital protocol. When the door closed behind Reed, the room did not relax. It sagged. Shoulders dropped a little. Hands fell from half-raised positions. Breaths that had been held for minutes finally escaped. The monitor kept doing what it had been doing unbothered. Beep, pause, beep. Logan's heartbeat carried on, stubborn and imperfect. Maya was the first to move with purpose. She stepped that back to the head of the bed, checked the mask seal with practiced fingers, then glanced at the blood pressure numbers. BP 80/38, the nurse read. Oxygen sat 72, heart rate 132. All right, Maya said. Those I can work with. We are still not celebrating. She looked tired. Not just late shift tired. Tired from listening to a conversation she had not asked to host. Robbins rubbed a hand over his face. So, he said quietly, that happened. Bree let out a shaky laugh that sounded close to tears. Is he even allowed to talk like that in here? She asked. You know, in front of everyone, like we are not going to remember any of it. Colin stared at the closed door. If they have their way, we will not, he said. Torres clipped his radio back more securely and looked at Claire. You good? He asked. It was a simple question. It landed heavier than it sounded. I have had worse conversations, she said. It was not quite a joke. No one laughed. No one laughed. Maya turned to her eyes sharpening. How much of that was real? Maya asked. About Riyadh, about Echo, about whatever name he kept using. Claire met her gaze. The instinct to deflect rose like a reflex. She could bat it aside with something half-true. She could pretend it was all confusion from a sedated man. The suits were gone from the glass, but the feeling of being watched had not left. Enough, Claire said. Enough that you knew where to put that needle, Torres added. He did not sound accusing. If anything, he sounded grateful. Maya looked at the dressing on Logan's side, at the neat tape over the catheter. You have done chest decompression before, she said. Yes, Claire said. In a hospital? Maya asked. Silence stretched for a breath. In a place where the ceiling did not buzz this loud, Claire said. Maya absorbed that. There were more questions lined up behind her eyes, but she did not let them out. Fine, Maya said. Here's how we handle it. On paper, this reads like a needle decompression performed under my supervision in response to decreased breath sounds and signs of impending collapse. It reads like good medicine. It does not read like a chapter from some classified manual. That is the truth, Claire said. It is one of them, Maya replied. She stepped over to the wall phone, picked it up, pressed a button, and waited. Radiology, she said into the receiver. This is Patel in Trauma 1. Is your hold lifted, or are we still pretending nobody is bleeding down here? There was a pause. The blinds rattled slightly as someone moved past in the hall. Good, Maya said. I am sending you a blast chest needle decompression already in place, vitals trending up. I want him on your table in 10. No arguments. She hung up and turned back to the room. CT is taking again, she said. Blood is on its way from the lab. We go back to doing what we know how to do. Robbins nodded. I will call transport, he said. No, Maya said. We roll him ourselves. I'm not trusting some temp nurse to navigate whatever is going on in that hallway. She looked at Claire. You stay with him, she said. You put the line in, you listen to that lung, you are next to him until they shove him into the scanner. Yes, doctor, Claire said. The formality sounded odd after everything that had just been said in the room, but it held. Bree moved to tidy the tray hands, still slightly unsteady. She dropped a clamp. It hit the floor with a sharp ring. Sorry, she said quickly. It is fine, Claire said. We are not grading style points tonight. Colin set the unused sedative syringe in the sharps container, his movements careful. He glanced at Claire, then away, then back again. So you are just one of those people, he said, groping for a word that did not exist in his training. Secret program ghost file, all that. I am your coworker who picks up your overflow charts when you are drowning, Claire said. That has not changed. He flushed. I did not mean, he started then stopped. You know what I meant. I know you still have 3 patients in beds that do not care about my past, she said. You should see them. Right, he said. Right, I will be in 2. He retreated faster than was strictly professional. The tension in the room did not disappear, but it shifted into something more familiar. The kind that came with time pressure and lab results and the logistics of moving a critical patient through a building. Torres stepped up on the far side of the bed, hands on the frame. I will walk with you, he told Claire. You do not have to, she said. I know, he replied. He checked the straps on the gurney, then looked down at Logan. How you holding up, man? Torres asked. Logan's eyes were half closed. He cracked them open farther at the question. Better than the roof, he said. Worse than my couch. That is a pretty wide range, Torres said. It has been a long night, Logan answered. His voice was weaker now, but clear enough. Claire leaned in. You are about to take a trip, she said. Big spinning circle, loud machine, nobody will be shooting at you in there. That you know of, Logan said. She gave him a look that almost approached irritation. If you want to burn energy on paranoia, do it after the scan, she said. He watched her for a second, then let his eyes soften. You know what you are going to write about that roof? He asked. In the chart, she said, I am going to write blast injury rooftop location mechanism described by patient as shaped charge. I am going to note that coordinates may have been compromised. That is as far as it goes. And outside the chart, he asked. Her gaze flicked to the door, then back. Outside the chart, I am not saying anything in this room that gives them more than they already have, she said. They know it was sold, he said. I saw it on his face. They know enough to build a second blast, she said. Knowing who sold it is what they will try to pull out of you later. I will not give them names, he said. You might, she said. Tired, drugged, sitting in a chair with someone who makes it sound like confession is the same as healing. He smiled without humor. You saying I need a lawyer? He asked. I am saying you need to remember that rooftop did not just belong to a file, she said. It belonged to the men on it. His jaw tightened. They will say the ones who died are beyond caring, he said. They are beyond correcting the story, she replied. They looked at each other for a moment that felt more solid than the walls. All right, Maya said sharply. We move? Bra, you are on the foot with Robbins. Torres, you clear our path. Claire, you ride the head. Monitor lines, catheter mask. Nothing gets pulled, nothing gets pinched. They slid the bed rails up and unlocked the brake. The gurney wheeled forward with a small bump over the threshold, then into the hallway. Outside Trauma 1, the corridor had the uneasy feel of a place that had been recently held and just released. Security officers stood at the ends, talking quietly into radios. Nurses moved with a little more caution than usual, glancing at every door, as if expecting another suit to step out. The two men who had flanked Reed were gone, absorbed somewhere into the building's bones. The overhead speaker chimed. South Wing lockdown lifted, the voice said. All staff resume standard protocols. Please direct any operational questions to your department supervisors. Operational questions, Robbins muttered. Sure. They pushed the gurney down the hall. The wheels squeaked on a scuffed patch of floor. The lights buzzed overhead but did not flicker. As they passed the waiting room, Claire glanced in. The television showed a commercial, now bright colors and smiling faces holding up bottles of something fizzy. No desserts, no convoys, no smoke. A little boy who had been there earlier waved at the gurney as it rolled by. His mother tugged gently at his arm but smiled politely at the staff. They turned a corner. The sign for radiology glowed at the far end, green letters on white, I say. Almost there, Claire said to Logan. He nodded small motion. Lungs still open, she added. Feels like it, he said. She adjusted the mask where it had slipped a little. You still owe me information, she said. About what? He asked. You said 5 people knew the updated window, she said. You and the spotter squad lead handler tech. Whoever handled that channel knows where the leak starts. You want me to give you a name? He said. I want you to decide when and where you say it, she said. Not with him in the room. She did not have to say which him. Logan breathed in, then out, following the cadence she had set earlier. You think he is right? He asked. About them letting you stay here if you keep your head down. I think he believes he is right until someone above him decides otherwise, she said. And in the meantime, he asked. In the meantime, I have shifts, she said. Rent, a coffee maker that only works if you hit it twice on the left side. That almost got a real smile from him. You could walk, he said. Change cities? Change names again. Names are heavier the older you get, she said. I'm tired of carrying new ones. They reached the CT suite. The tech on duty stood waiting door, already open. Is this our special delivery? He asked. Trying for levity and almost making it. This is Pierce, Maya said. He is stable enough to image. Needle decompression in place. You treat that line like gold. Got it, the tech said, eyes scanning the catheters and tape. They moved Logan onto the CT table with as little jostling as possible. He grimaced once, then let himself settle. Claire stood at his head, one hand on his shoulder, the other keeping the oxygen mask steady. You are going into the tube, she said. It is loud, it is cold, nobody can touch you without you seeing their hands. He looked at her. You are staying where I can see you, he said. As much as they let me, she said. He held her gaze for another second. If they try to move me without you here, he said, I make noise. Good, she said. Make it the right kind. The tech moved to his console. The table began to slide into the opening of the scanner. The ring lit up pale and clinical. The sound started a mechanical whir and a low hum that built on itself. Logan's eyes closed, then opened, then fixed on the slice of ceiling he could see beyond Claire's shoulder. She lifted her eyes to the same piece of ceiling. It was flat and white, unremarkable. No dust, no cracks, no smoke. She listened to the sound of the machine and layered it over the memories of rotors and artillery and static in her ears. For a moment, time folded past and present, sitting in the same breath. Then she let the old sound go and held onto the one in front of her. "Keep breathing," she said quietly. The machine answered with its steady mechanical thrum, tracking the damage inside a chest that had already carried more than enough for one night. When the scan finished, the room felt too quiet. The table slid back out of the ring. The tech stepped forward and unlocked the headrest. "All done," he said. "Stay still for a second." Logan blinked up at the ceiling, then over at Claire. "That it?" he asked. "For the inside pictures," she said. "Yes." Maya stood at the monitor with the tech. Gray and white slices flicked past on the screen, cross-sections of bone and muscle and air. She leaned in, tracing an invisible line along one frame. "How bad?" Claire asked. Maya did not answer right away. She let another few images scroll. "Pulmonary contusion on the right," the tech said softly. "Some fragment tracks, but nothing that went deep enough to shred everything. No major vessel disruption." "Ribs?" Maya asked. "Cracked here," he said, tapping the screen. "And here, no full flail segment." Maya nodded. "He will need a chest tube placed properly," she said. "ICU bed pain control a long list of things he will complain about." "I am sitting right here," Logan said. "We noticed," Maya replied. She peeled her gloves off, dropped them in a bin, and came to the side of the table. "You are lucky," she said, in a very specific way. "Feels specific," he said. "You have damage," she continued. "A lot. Bruising contusion bone. You should be in more pieces than you are." "And yet," he said. "And yet," she agreed. "The charge that hit you was focused. Too focused. It spent itself where it was told to." He looked at Claire. "We keep coming back to that," he said. "He keeps coming back to us," she replied. They transferred him back to the gurney, careful with the lines, careful with the catheter. The tech held the portable monitor until it was secure again on the side rail. "ICU knows he's coming," Maya said. "They are clearing a room." "You heading up with him?" Robbins asked. "For the handoff," she said. "Then I need to get back down. We have an ER full of people who still think the worst thing that can happen to them tonight is a broken ankle." She squeezed the rail once, then looked at Claire. "You stay here or you come back with us?" she asked. "I will take him up," Claire said. "Then I will come back and pretend I'm still the quiet one." The corner of Maya's mouth moved. "You are allowed to be more than one thing," she said. "Not on the badge," Claire answered. Torres took his place at the foot again. Robbins walked ahead to clear the corridor. As they rolled out of radiology, the lights in the hallway seemed softer. The overhead speakers were silent now. No more lockdown announcements, no more liaison warnings, just the usual calls for respiratory therapy and housekeeping. They moved through the hospital in a small unit, gurney in the center, staff around it like a boat surrounded by swimmers. On the ride up in the elevator, the air felt close. Logan stared at the panel of Button's eyes, tracking the glowing numbers. "You ever get used to this?" he asked. "The box between floors?" "Some people take the stairs," Claire said. He smiled faintly. "You still do?" he asked. "Sometimes," she said. The doors slid open onto the ICU floor. The lighting here was dimmer monitors casting soft green and blue glows. The smell shifted, fewer disinfectant wipes, more plastic, and warm electronics. A nurse at the station looked up as they rolled past. "This is Pierce Logan," Maya said. "Blast chest. Needle decompression already done, needs a proper tube and a bed that beeps more than mine." The ICU nurse nodded, face already switching into assessment mode. "I have a room," she said. "Number 7, right side near the window." They eased the gurney into the room. It was smaller than the trauma bay, quieter, but the machinery stood ready in every corner. Maya ran through the handoff efficiently. Vitals, mechanism, interventions. When she finished, she stepped back and let the ICU nurse start her own choreography. "I need to get back downstairs," Maya said. "People keep bleeding when I'm not looking." She met Claire's eyes. "You coming?" she asked. "In a minute," Claire said. "I will walk out with you." Maya nodded and left her footsteps fading down the hall. Claire stepped closer to the bed. The ICU nurse worked around her checking lines, adjusting the monitor, hanging new fluids. She did not ask questions about call signs or echo. To her, this was one more body in a bed that needed watching. Logan watched Claire's face. "So," he said, "ICU, that means I'm officially not dead yet." "You were officially someone else's headache for a while," she said. "That a relief?" he asked. "Some parts," she said. "Some not?" He shifted, then winced. "You did not have to take the chest hit personally," she added. He made a sound that might have been a laugh. "I have always been bad at avoiding blast radiuses," he said. "Maybe learn," she told him. He looked past her to the window. From this angle, all he could see was a slice of dark sky and the reflection of the room. "You going to come back up here?" he asked. "After your shift?" "Depends on how many knife fights and drunk falls show up," she said. "You know what I'm really asking," he said. She did. She took a breath, felt it slide into her chest, out again. "I am not disappearing," she said. His eyes softened. "Not again," he said. She thought of the stairwell, the way the radio had gone dead, the way everyone had told him she was gone. She thought of the years she had spent letting that be true for him. I cannot change that night, she said. I can answer the call in this one. Good enough, he said. They sat in a small pocket of quiet while the ICU nurse finished her checks. When she stepped out to grab supplies, Logan spoke again. They are going to come to talk to me, he said. Ask about the window, about who touched the channel. I know, Claire said. You want me to tell them anything for you? He asked. She thought about Reed, about the way his voice had wrapped around words like resource and capacity. She thought about the way he had said silence was a courtesy. No, she said. They have what they wanted. And what do you have? He asked. She looked at him, at the dressing on his side, at the monitor showing numbers that were not good, but not catastrophic. A patient who is still breathing, she said. He let his eyes close, tired beyond argument. Static, he said quietly. She almost told him not to use it, almost corrected him. The words sat in the air between them, familiar and wrong, and somehow theirs. Yeah, she answered. Thank you, he said. For the lung, for not staying dead. You needed breathing, she said. That was enough. He did not reply. A moment later, his breathing evened out into something closer to sleep than exhaustion. The sedative and the pain and the sheer weight of the night finally pulled him under. She watched his chest rise and fall a few times more, just to be sure her hands had not lied. Then she stepped back. In the hallway, Maya waited by the elevator, arms folded. You done? Maya asked. For now, Claire said. They rode down together. The elevator hummed. Neither spoke. When the doors opened onto the ER floor, noise rolled in, familiar and almost comforting. Phones ringing, someone paging a consult, a distant cough. The chaos felt smaller than before. At the nurse's station, Bree was rebandaging a hand. Collins stood over a chart, brow furrowed. Robbins argued with someone on the phone about bed availability. When Claire walked up, a small space opened without anyone seeming to move on purpose. Chairs shifted, clipboards nudged aside. She set her hands on the edge of the counter, feeling the grooves in the fake wood. You are back, Bree said. It is still my shift, Claire said. Collins looked up from his chart. Pierce make it to ICU okay? He asked. He did, she said. He nodded, relief passing over his features. Good, he said. That is good. No one brought up Reed. No one said echo. The words hung around the edges of the room, anyway faint outlines. Robbins hung up the phone and looked at Claire. You still on board for intake? He asked. We have 3 ambulances circling 2 walk-ins and somebody in the waiting room who insists he is having a heart attack because his arm tingled when he sneezed. Put me where you need me, she said. He nodded once as if that were the only answer worth hearing and shoved a chart in her direction. Trauma 2, he said. Let us see if this one bleeds in a normal way. She took the chart. On her way past the waiting room, the television flickered. For a second, the picture broke into gray and white snow, the sound of static spilling out into the chairs and floor. She paused. The image cleared. A local commercial came back on, bright and hollow. Behind the glass, the red numbers on the wall clock read 11:03 p.m. Claire lifted a hand to her chest, fingertips resting over the steady thump inside. She counted 3 beats, then let her hand drop. Keep breathing, she said under her breath. She turned toward Trauma 2. As she walked, staff stepped aside just enough to give her a clear path. No applause, no speeches, just a small unspoken space in a corridor that had not made room for her before. She moved through it, the neon lights above buzzing softly, the hum of the ER folding back around her as she stepped into the next room. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.